How's the day like in Queensland, Prince?
It's pretty good. As usual, always busy and nice and sunny out there. So it's really nice.
Yeah.
Not like Melbourne, but I'm not sure how many people have joined us today from which part of the world. So it'll be exciting to see what sort of questions and information they get after the session. And I would like to also mention, Aayushi, if you can just give a bit of an overview for the joinees who have already joined the session, so at least they know what discussions we're going to have or what information we're going to provide in the session. So at least, they have a bit of idea about it.
Sure. So hi, everybody. Now, this is Aayushi. I'm from Melbourne. We are in the cold weather these days. I know we have Prince with us, as Len already introduced. He's from Queensland. He's a registered migration agent. Both of us have been with the company for more than 8 years, more than 8-9 years, I would say. So yeah, we would love to share our expertise into anything as we can, and we'll provide you as much information as we can. Now, first of all, I welcome you all to day 2 of Aussizz Conclave. I know it has been a very informative day for those people who have been listening to previous sessions for yesterday and today, but we have a lot more sessions coming up in the next 3 days. And today's session, we are going to cover about niche courses. Now, these courses are pretty much allied health professional courses. So that is basically covering physiotherapy, biotechnology, speech pathology, lab medicine. So those sort of courses, which is again for a specific cohort of people. So not all or everybody does these sort of courses, but again, we are more than happy to give you out some insights in regards to this course. Just gonna share my PPT now that we have enough people here. Prince, let me know just in case if I'm not audible, if my voice cracks or something.
No, it's all good. I mean, so good, all good so far. But,
so far, so good. Yeah. Okay. Sure. Okay. Now, guys, those who are participating, I would request you all to please be interactive as much as possible. Please post your questions. These questions will be addressed at the end of the session. So Prince and I will be able to give you out all the information, all the answers of your questions to the max permissible time limit. So let's start with my PPT here. Is my screen visible?
It is, yeah.
Yeah, okay. Okay. Okay, now here we are. Again, these are the sub-products of Aussizz services. So we're not only specialized in education and migration, but we also have PT tutorials, IELTS tutorials. Get My Policy. This is one such good policy where you can actually go to this website and compare all the policies, be it in your any visa. So let's say if you're looking for a student visa, overseas student health cover or overseas visitor health cover, you can just go on this website, type your dates and type your visa that you're looking for the policy for, and it will straight away give you a comparison and all the inclusions that the policy contains. So this is one such very, very good policy, very helpful and very handy, I would say. CCL tutorials, these are again one of those informative information in regards to the CCL and NATI. Professional Year Australia, PT tutorials, and we have Aussizz. Now, this is again one such app which is literally the migration information now in your pocket. So it basically covers all the information in regards to your skill assessment, your eligibility for the visa, your nomination criteria, any changes, any visa fees, everything that you have. This is like a one-click go. So you literally download these application into your phone and just select your occupation that you're looking for. It'll give you a points calculator and you can add all the points, everything that you would like to have, and you will be able to get all the information right in one go. So this is again one of the very, very useful and helpful app that you can go ahead and apply with. Okay. Now we are talking about these allied health courses. Now, one thing you have to understand when it comes to these allied health courses is these are not in the direct line with the health professionals. Now, these are direct line doctors and nurses pretty much. So we are not talking about those people, but we are talking about the backbone again of this health industry. Now, this is again those professionals which are literally working back end, but they are not in so much of the forefront. So rare courses, these courses are pretty rare, but then again, one of the very popular, as I said, that these are for those cohort of people which has a special affinity towards the study career. So working in the health industry, but not like a direct linking with the health professionals. So here but again, you have to understand that Australia has literally 1/3 of the professions which are covered by these occupations, and not a lot of people are aware of this. So here we are giving you information in regards to these courses. By going ahead with these professional courses, you can see that these are the different places that you can work with. So hospitals, private practices, community health centers, mental health services, care homes, universities, schools, public sector, government, in fact. So there are a lot of information, a lot of places that you can actually go ahead and work your occupation through and be a health professional in this industry. Now, we are going to start with one such course called laboratory medicine. Now, obviously, this course is again one of the popular course amongst international students, but you have to understand that this is not an easy course to study. So this course involves detecting and diagnosing diseases. It's more sort of on the molecular level. So you are playing a very important part in the health professional when you are doing this course. So basically, a lot of doctors also depend on the decisions taken by lab medicine courses. Now, what is lab technician or lab medicine scientist? So basically, this is a science that deals and detects the diseases. Now, this the easiest example I can give you is the RT-PCR. Basically, so blood test samples that you can give, any new medicine that are going to research, any vaccines that are going to be introduced, these are all part of these courses. So someone is raising hand here, but I think we'll be taking questions in the end, unless it is a technical glitch. Please let me know. Yeah, so one of these courses, so any diseases that are caused by the microorganisms or the pathogens falls under these categories, which are detected by lab medicine scientists. So when they detect the course, they are the scientists, and on the technician level, they are the lab technicians. Now, again, if you see, there are pretty stable PR pathways, and the courses starts from vocational sector course. So you can see that those who literally don't have any background into these courses, they can start from the vet sector. However, you have to understand that when the skill assessment process is considered, it has to be accredited with AIMS, and the skill level that they accredited this course is only level 1. So that means you must have bachelor's or master's into these courses. Now, you can see that it starts with vet sector. Now, this is certificate 3 in laboratory skills, certificate 4 in laboratory techniques, diploma in lab technology, and these can give you credits into your bachelor's courses. Now, let's say if we talk about the bachelor's, what are the entry requirements for bachelor's? Now, with bachelor's, you need to have year 12, but it has to be in the cognate. So you must have studied science course, that is preferably your physics, chemistry, maths, biology. But when it comes to master's degree, the cognate background is a must. So basically, you should have studied a biomedical or a lab medicine, biological science, a lab technology course to get into this field. So again, for offshore students who are looking forward to study this course, if they have a similar background, you should have a high GPA. There are 4 universities with these courses. That is CDU, that is Charles Darwin University, University of Tasmania, RMIT CQU, that is Central Queensland University. Now, those who have a similar background, not 100% cognate background, you may have a chance because CQU does offer a couple of subjects to do in advance before you go ahead and enter this course. So there is a pathway. However, we need to see what are the units you have completed in your previous bachelor's. There are also scholarships available up to 25% when it comes to these courses. So you can go ahead and study this course at any of the desired university. As this is again one such career prospects where doctors even depending on your decision, they can take a decision, because obviously they need to rely on the research that you have done as a lab technician. So again, this is very, very popular field. Now, these are the employment and career prospects. Now, you can see that 70% of clinical decisions are made by doctors, are based on the information. Now, the employment that you may find here is in food or cosmetic industries, veterinary science, forensic labs, universities, private pathology providers. So many, many providers, many ample number of opportunities, especially when it comes to post-COVID. I think these courses have literally come into picture, and they have started gaining a momentum when it comes to these. Now, if you see the job market statistic, obviously the average earning, now these statistics have been taken from National Skills Commission Australia, so you know that the data is real. Now, the average is 1460 a week, whereas when it comes to lab medicine, it's 1871 per week. And again, this is only a starting salary, so don't count this salary as your future salary. But obviously, if you are looking forward to study something and then eventually gain a higher position, obviously these is going to increase by leaps and bounds. Now you can see after COVID, the 1 year change. Now again, we're talking about since 2021. So this has already been into effect, this 28%. And again, with 5 years, it is going to be increasing by 15%. So this is going to be stable. I'm sure this is going to be even more down the line because people are needed. This is one of the thriving sector when it comes to lab medicine. Now, the next course we are looking forward is psychology. Now, this is very interesting course because this is pretty much like studying a behavioral science, study something that what is a human mind thinking or how people are behaving or communicating, be it in a private, be it in public sector, wherever. So psychology is great course when these sort of things appeal you. When it comes to the career choices, now let's say with bachelor's and master's, obviously bachelor's entry requirements similar. Now pretty much with all science courses, when it comes to bachelor's requirements, they are year 12 is a minimum, and it must be a cognate, which is it must be a science student. So you must have been a science student by taking physics, chemistry, maths, biology into your year 12. That can only lead you to these courses. So they are pretty straightforward, but when they do have an additional caveat when it comes to the entry requirement for bachelor's, because sometimes they require like a mature age student. That means more than 18 years of age is a mandatory requirement, because to study a psychology, you must be mature enough to study those courses. When it comes to Masters of Psychology, now this is a bit stringent because obviously Masters of Psychology is pretty challenging to study. Those who have already done bachelor's. Now with Masters of Psychology, for example, clinical, if you're talking about that course, now they require a 4 years of Bachelor's of Psychology that you would have studied in your home country. Now this qualification has to be assessed. So the qualification assessment has to be done from APAC, which is the Australian Psychology Accreditation Council. Yeah, APAC, correct. So your overseas qualification must be accredited by them, and then also the entry is competitive because you have to submit a letter of reference from the qualifying referee that is required at the admission time. Now, this is something which is very mandatory along with the admissions for the Masters of Psychology program. Obviously, pretty much all the universities would have 7 each as their entry requirement in IELTS or PT. And I think there is a college called ACAB, which has a lesser requirement depending on your options. But obviously, as I said, we have to see the documents for you to assess those degrees. Again, I've jotted down the list where you can actually go and see what are the accredited courses available from these websites. So this is APAC website, and you can have a look at what are the accredited programs available in terms of this. Now, in terms of career prospect, now mental health is technically taking preference these days, and especially, as I said, I'm reiterating myself here, but I know post-COVID, these sort of occupations have been pretty emerging out of it because mental health is again something which has been looked upon in a lot of different ways. And now these days, it especially after pandemic, caring about someone's mind is very important, and psychologists do play a very vital role here. They have a great chance to be a pioneers in this industry. So again, there are ample number of opportunities available. Now, when it comes to skill assessment, there are 2 different things. So one is you get a assessment as a general psychologist, that is from PSY, so Psychology Board of Australia, which is based on what you would have hold as a general practice. However, if you want to be like a specialist psychologist, so let's say if you want to be a clinical psychologist or a community or a health or a sports psychologist, in that case, again, you have to get an endorsement. So you have to register yourself, work in that particular area, get an endorsement from that particular body where you are working with, and then you can start working as a specialized psychologist into your own field. This is a job market statistic. Now, again, you can see 1857 per week, which is pretty good as compared to other occupations. Again, this is only the starting base of salary. Now, initially, the psychologists were dropping down because obviously straight away after COVID, people did not realize that this is something that they would need down the line. But then again, the industry have been booming since then. And again, this is double the data of what it is here since 2021. Now, again, one such course is physiotherapy. Basically, this course is rehabilitation studies. People have been going ahead with these sort of courses. In fact, going ahead with these sort of therapies, because obviously they don't include surgery or medications or anything. This is more sort of like treatment with exercises, with massages. I think nowadays they also use some laser techniques and some heat therapy kind of things, but they don't use any medications or there's no surgery involved. So these are again one of the good courses or good light science courses that you should study. Bachelor's and masters are available in these sort of courses. Now, all these courses, as I said, are pretty specific cohort for the people, and they have bachelor's and masters. They must have a science background. So this is something that you have to have. Bachelor's is again relatively easy to gain entry as it is only based on your year 12. When it comes to master's entry requirement, they need cognate background. The only one challenge students face in this course is something in regards to the availability of the seats, because universities only have 30 seats per semester, and this is again divided amongst international and domestic students. So this is something that you really have to look into, because you have to have, you must be like academic brilliant, you should have a strong reference and also a strong suitability statement. Now, when I talk about suitability statement, this is basically kind of SOP, but that includes more sort of detailed documents in regards to why are you looking forward to study a master's of physiotherapy? What is the career prospects into your own home country? Why are you spending this much? And what is the return on incentives in your home country? Why is this going to be beneficial into your career prospects? What is your work experience? Is the work experience relevant to what you are studying? Does it require to study? So there are a lot of prospects components included in this suitability statement. And this is something that is mandatory only at the time of application. So again, you have to have you should have achieved this before you enter for your studying master's courses. Pretty much all these universities, we have Swinburne, University of Queensland, University of Canberra providing these courses. They do have intakes available for SEM 1 and SEM 2. There are a couple of universities which are also giving up to 30% of scholarship, but again, that depends on the grade that you would have scored in your previous qualification. Now, I've jotted down a link for AFRA. So this is basically all governed by AFRA, and they have again an accredited program. So with these sort of courses, you must make sure that any program you study, it has to be accredited with that particular authority. In this case, we are talking about AFRA because AFRA is the registration body for this. Now, when it comes to career prospects, you can see that the demand have been in leaps and bounds, because obviously physiotherapy is one such course. It's an emerging field, and people have been a lot of career opportunities in metropolitan rural areas. They may work independently or as part of a team of healthcare professionals. And again, these are the different places that they can work with. Apart from this, I would also say that you may have to find, you may be able to find government jobs, because obviously there are a lot of government policies for health promotion going on, for health related policies, health related courses. So they are running so much promotion, so many promotions that you can always enable yourself to be part of government jobs as well. So again, they are most in demand when we are discussing such courses, such allied health courses. Now you can see the job market statistics. The average earning is 1,444 per week. 1444. Again, the demand has been increasing. Now you can see this is literally 25% in 1 year and 53. This is mostly the double the data in next 5 years. So industry is requiring lots and lots and lots of physiotherapists. So this is again one such popular course. Now, occupational therapy. Now, physiotherapy and occupational therapy are pretty interrelated courses, I would say, but then there's a difference. So basically, physiotherapist is the one who focuses on improving the patient's ability to move their body, whereas the occupational therapy focuses on improving patient's ability to perform activities in their day-to-day life. So this is again a different sector of that field. Now, it is like a holistic alternate science professional of health industry, where you deal with physical, mental, developmental, emotional sides of people and cure them using different techniques, making them suitable to work, to do their day-to-day activities. It is again one of the health allied profession where it is not very prevalent in lot many other countries. But again, when we talk about Western countries, and especially if I talk about Australia, this is again very popular course, and people have been using occupational therapist a lot in day-to-day life as well. Now, again, with these courses, you can see there are bachelor's and master's courses. Again, the accredited courses are available on AFRA's website, so you can check what are the accredited courses. Bachelor's, pretty simple, year 12 with science background. With master's also, the equivalency is required. So you must have a cognate background. Now, this course can also be done by those people who have been doing exercise science as part of their bachelor's, or even sports management, biological science, physiotherapy, exercise physiology. So these sort of courses, if you would have done in your bachelor's, you can still be eligible to apply for occupational therapy course. Now, again, one thing is you have to write a personal statement, which is a suitability statement that I was talking about in physiotherapy. A similar thing applies to occupational therapy as well. Again, you can see what are the career aspects. Now, all these fields are not just restricted to one area, if this is something which is very prevalent in all my slides, because you can see that even if it's occupational therapy, you're not only as an occupational therapy, you have so many different areas to work on. So this just doesn't confine you in one position. You know, there are a lot many different areas that you can actually go ahead and work with. Again, the job market statistics, you can see there was a declination in the first year. However, there's the increase of 77% in the next 5 years. So obviously we are in the third year we're talking about, and the increase has been leaps and bounds. Now, again, this is where most of the healthcare professional and assistants, social assistants, public administration, and safety and education and training. These are the industries that they mainly focus on. Couple more to go, but I would say speech pathology. Now, I get so many international students asking for this course, but they literally don't know what this course is about. So this is again mainly, so speech pathologist is a person who helps a child as well as adults in communicating disorders. Now, let's say these communicating disorders can be in speaking, listening, stuttering, social skills, writing, reading. They don't know how to use their voice. So this is basically that branch which allows you, which literally tells you how to speak. And if you're fumbling, if you're not able to speak properly, this is something that you should focus on. Bachelor's is available again with these universities, Curtin, SU, ECU, ACU, CQU. That's rhyming basically, what I mean. With master's courses, it is available with Curtin University, La Trobe, and Swinburne as well. You can get jobs in different fields. Now you can see that there are different healthcare organizations opening up for this role, and this is something that they have. Also, there are more and more spendings and budget allocations to the NDIS scheme, which is a National Disability Association of Australia, and they deal with all the disabled people. And this is again one such field of that. And they do have more of these allied health professionals. Job marketing are increasing. So hence, to fill in the gaps of these aged care people or taking care of other people, again, this course plays a vital role here. Now, again, you can see this is the highest amount of earning you can see here. That's 1827 per week. Obviously, there is an increasing opportunity from 23% to 33%, and it is going to be increasing in next few years. And the last I have here is biotechnology. Now, this is again a good course. It's a mixture. It's an amalgamation of biology and technology. So those people who are looking forward to study IT and biology, this is again one of the very good course. Basically, it has been in MLTSSL list since last 3 years, 2 to 3 years, I think. This course deals with the molecular level of study, a microorganism level of study. And this is again one of the very popular courses. You can see bachelor's courses. We have Bachelor of Science in Biotechnology, Bachelor of Science in Biomedicine, whereas with the masters, I think masters are more popular when it comes to these courses. Masters has bioinformatics as well. Now, bioinformatics is basically those people who want to be evolutionary biologist and they would like to study a mathematical tool as part of this biotechnology course. So this is again one such course that people can lean into, and you have immense number of job opportunities available. What are the careers available is as a research scientist. So again, life scientists, biotechnologists, molecular biologists, again, dealing with the vaccinations, researching something, having something, inventing or discovering is something that have been done by biotechnologists. Thank you so much. I think I've done with pretty much all the courses. Hope I've explained all the information in regards to this. And probably I'll have Prince to start on the career prospects, and then we can just take on all the questions we have.
Sure. Thank you so much, Aayushi. Appreciate your time and the information you have shared with all of us, including myself. There were a few things which were not, I wasn't aware about the courses and the offered university offering those courses. So thank you so much for sharing that. Before I start the session, I'm not sure, Lee, if you're still connected with us. Do you mind if we should be taking any questions as of now, or should we continue and we can take all questions together later?
Yeah, please continue, and then we can get the question later.
All right, sure, not
Yep,
a problem. Thank you
thank
so
you.
much, Lee. I'll just get my screen as well. For those of you who have just joined or who have already connected with us from the beginning, myself, Prince, I'm a registered migration agent. I'm based in Queensland, Brisbane, but Aayushi is based in Melbourne. As you all know, she has already discussed all the options available to the, allied health courses and the universities offering those courses and what are the pathways that it leads to if you study one of those courses, what she explained. And my job is to provide you information regarding what are the migration pathway, if that is something you're interested in the future, how you can avail your permanent residency in Australia if you study any of those courses. If you have any questions regarding any of the particular course, or if if it's regarding the entry requirement, or you can speak to Aayushi about it, or if it's regarding the migration pathway, I will be more than happy to answer all those questions. So let's get started. I'll get my screen up there. 1 second, please. Alrighty, everybody can see my screen. Aayushi, Lee, are you good to see my
Yes.
screen?
Yes.
Yes, we can.
I was about to tell you. Yeah.
All right, so thank you so much. So just for I believe, Aayushi, you've already provided the information about the services we provide and the Aussizz mobile application or a mobile app where everybody can find out what occupation, with how many points, whether they can apply for 189, 190, or 491, which are like, general skill migration visas. So it's a pretty good tool if you haven't downloaded this app on your mobile yet. Pretty handy to use. So keeps you always up to date regarding different occupations. So I've used it myself, so it's pretty good. Highly recommended to use this app. And the other services we offer, it's not just migration and education. We do provide PD and IELTS coaching, CCL coaching, health insurance, as well as professional year, which is mainly for IT, engineering, and accounting background applicants. So let's get started, everyone. As you can see on the screen, health occupations. We're going to discuss mainly about medical laboratory sciences. We already had a session, I guess it was earlier today or it was yesterday. I'm not 100% sure, but for registered nurses and enrolled nurses, we already had a session. I'll give you an overview, a little bit of. Was it today? Was it? Okay.
Yeah.
So yeah, I mean, I'll touch base on this a little bit, but I wouldn't go in detail. And the other ones are general practitioner or GP or industrial pharmacist, pharmacy technician, medical laboratory technician, and few more. Talking about different occupations. So some of the, these nominated occupations require the qualification to be at either at a diploma level or bachelor's level. So, different occupation have got different requirements. And when we look at the migration perspective for the particular occupation, we need to see which occupation we are talking about and what's the minimum eligible requirement or qualification required for that particular occupation. So I'll be discussing mainly pretty much all the occupation on the screen. As you can see, medical laboratory scientist on the right hand side on this of the slide, if you see, you will see AIMS, MLTSSL, AIMS, STSOL. So for those of you who doesn't know in detail about the requirements of what's the difference between MLTSSL and STSOL, it is all about the list. So MLT, I refer it as a long-term list. STSOL, I refer it as a short-term list. So if your occupation is a long-term list, it's always beneficial. It means you can apply for all three visa categories under general skill migration, which is 189, 190, and 491. But if you talk about short-term occupation list, that's the reason why I put this on the screen. Medical laboratory scientist comes under long-term list. MLTSSL and medical laboratory technician comes under short-term list. So you can only apply for 190, 491. I'll be explaining in detail about what these 189, 190, and 491s are down the track in the few slides afterwards. But if you see the names on the right-hand side, AIMS, 𝐸MS, 𝐻𝐻, A-Pharmacy, 𝐻𝐻. So obviously these are the assessment bodies for the particular nominated occupation. If you have a look, like, hospital pharmacists, retail pharmacists, they get assessed from Australian Pharmacy Council, whereas pharmacy technician gets assessed from 𝐻𝐻. So different assessment body for a different occupation have got different requirements for the skill assessment. Skill assessment is something you require when you finish or when you complete your study, when you apply for when you want to take a first step towards your permanent residency to apply in Australia. That is the first thing you got to look into, how to get the skills assessment in that particular occupation that you want to nominate for the permanent residency. So skill assessment is what we are discussing at the moment. So as I mentioned, on the left-hand side of this slide, you can see all the occupations. There are a few more on the next slide. Occupational therapist, physiotherapist, speech pathologist, biotechnologist, microbiologist. So on the right-hand side, if you see the assessment body, it's not pretty much same. All the occupations have got different assessment bodies. On this screen, you can see APS, which is, Australian Psychological Society, and OTC, Occupational Therapy Council, APC for physiotherapists, Australian Physiotherapy Council. So different assessment bodies, different requirements. So we will go one by one for pretty much all the assessment bodies. I'll try to cover up as much as I can, but as I mentioned before, if you have any particular question about your qualification or your occupation, you can ask once we are done with the session. But some question we may not be able to answer straight away. In that case, I request you to send us an email directly. So when I get a chance, because sometimes we have to do a bit of research for a particular question, because if any of you who have done a qualification overseas and wants to check his or her eligibility regarding the skills assessment, it may not be possible for me to answer that straight away unless I look at the profile and understand whether you meet the skill assessment requirement or not. But saying that, if any of you who have completed Australian accredited qualification, which Aayushi already spoke about, if you have done Australian accredited qualification, majority of the qualification you have completed in Australia are accredited. What it means that once you complete the study, once you complete your qualification, you can apply for the skills assessment directly, and basically you get the skills assessment and apply for the permanent residency down the track with that skill assessment. But depending on the occupation, the requirement could be different for a different occupation, which we need to look in detail once we have the profile. So let's get started with the skill assessment bodies. As you can see it on your screen, ANMAC, which is mainly Australian Nursing and Midwifery Accreditation Council, mainly for enrolled nurses and registered nurses. So ANMAC is the skill assessment body provider. Sorry, give me 1 second. Sure. And the second one is 𝐸MS, Australian Institute of Medical and Clinical Scientists. So this is mainly for the medical laboratory scientists. If anybody wants to get the skills assessment done, 𝐸MS is the assessment body where you finish your study. Once you complete that accredited study, as I mentioned before, you reach out to the assessment body saying that, hey, I've completed my qualification. That's the completion certificate. And whatever the requirements are, some assessment body may require you to have English language proficiency, superior, or depending what the requirement is. Some assessment bodies have got requirement for proficient English. Some of them got the requirement of superior English. So, but it's not just the accredited qualification. You have to meet the English language proficiency or English language requirement as well for the assessment body. However, once you meet all these two requirements, you can apply for the skill assessment, which gets completed in usually 2 to 3 months of time. 𝐻𝐻 is another one where we get the skill assessment done for pharmacy technician, industrial pharmacist, biotechnologist, pharmacy council for retail and hospital pharmacist. So pharmacy, like, you must be thinking, what's the difference between 𝐻𝐻 and pharmacy council? Because a couple of occupations for related to pharmacists gets assessed under 𝐻𝐻. Pharmacy council do the retail and hospital pharmacists. So this has been assessed from the assessment body itself. When we talk about pharmacy council, retail and hospital pharmacist, your qualification plays a very important role. If you have done an accredited qualification, you can reach out to pharmacy council directly. You get your skills assessment done. For anybody from overseas who wants to get his or her skills assessment as a retail or hospital pharmacist, may have to sit for a CAPS exam, which is kind of a sitting exam that you have to appear for, and you clear that exam, then only you get the pharmacy council skill assessment. Whereas 𝐻𝐻, you need to have minimum 1 year of post-qualification experience in your relevant occupation. Like, for example, if it's industrial pharmacist or pharmacy technician, you need to show or provide evidence of minimum 1 year of post-qualification experience to get eligible for the skills assessment. Moving forward, we've got Australian Medical Council. That's mainly for the doctors or general practitioners. AMC is the one who does the assessment. So majority of the applicants from overseas obviously have to sit for the exam. However, anybody completed the qualification from Australia gets eligible directly, and it's not hard process for them to get the skill assessment. The next one we have on the list is Australian Psychological Society. This covers the psychological occupations like clinical psychologist and few other ones. And Physiotherapy Council, mainly for the physiotherapist assessment. So going on further, we got ANMAC skill assessment, as I mentioned before. For ANMAC skill assessment, if you have done a bachelor's qualification, a master's qualification from Australia, you can apply for the registration straight away and you can get your skills assessment done from ANMAC. But there are applicants where we have seen they have done the qualification from overseas, because we get a lot of Filipino nurses reaching out to us. They have completed their bachelor's qualification from Philippines or India or any other part of the world. They've completed the qualification from their home country, and they've been working as a registered nurse or an enrolled nurse in their home country. They wanted to know what's the process to get the skills assessment done. So for those nurses who are registered overseas, they have to sit for an exam, which is we call OBA. So it's an exam which consists of two parts, NCLEX as well as OSCA. So there are two stages of this exam. OBA is outcome-based assessment program. This is what you have to, outcome-based assessments exam that you have to sit for. Once you clear this exam, you can register yourself with APRA, and the requirement to register with APRA. APRA is a nursing, registration body. Once you register with them, you're allowed to work legally as a nurse in Australia. And once you register with APRA, then you can apply for the skill assessment with ANMAC, because that's one of the requirements for ANMAC, that they need you to have a registration with APRA if you were to apply for an enrolled nurse or a registered nurse skills assessment. So I hope we are clear on ANMAC skill assessment. But if any of you have got any doubts, as I mentioned before, that we had a session this morning about the nursing, particular nursing occupations, as well as their outcomes and the ways how overseas nurses can get settled in Australia by getting registration, go and do check that session. I'm sure that would be very beneficial to all of you. AIMS skill assessment, which is Australian Institute of Medical Science, medical laboratory scientist, which is one of the popular courses in Australia in terms of permanent residency. If you have done a bachelor's or master's qualification, accredited qualification, you get eligible to apply for AIMS skills assessment directly. You need minimum bachelor's or master's, as I said, for medical laboratory scientists, but there's another occupation called medical laboratory technician, which requires only diploma qualification with 2 years of experience in last 5 years. That makes you eligible for skill assessment as a medical laboratory technician. These two occupations are very popular, very less competitive as well. Not many applicants out there in this two nominated occupations. Anybody willing to get into this field or already into this field, I would say it's a very good profession to get into in terms of a career as well as at the same time for the permanent residency prospect as well. So as I mentioned before, for medical laboratory scientists, these are the courses as you can see on the screen. Bachelor of Medical Laboratory Science, Masters of Medical Laboratory Science, Bachelor of Biomedical Science, Masters of Laboratory Science, and Masters of Clinical Pathology. All these courses are accredited courses, but if any of you who wants to know in particular about any of these courses, listed courses, my colleague Aayushi would be here to assist you after the session when we have questionnaire round. So if you can ask at that time which particular course you want to know about, but if you have any other questions, obviously you can ask anytime. Moving forward, we've got medical laboratory technician. As I mentioned before, diploma qualification is the minimum qualification that is required for a nominated occupation as a medical laboratory technician. One thing I would like to mention here, a lot of overseas applicants who have done bachelor's qualification, they need to sit for a CAPS exam, which they need to sit for an examination to get the skill assessment. But in case if they do not end up getting the exam cleared, they can opt for medical laboratory technician skill assessment as well, assuming they have the minimum experience work requirements met. So that's why I mentioned that it does not require the completion of professional examination. So applicants who fail the AIMS professional examination qualifies for the assessment under this occupation. So if anybody from overseas has applied for medical laboratory scientist, but for some reason they couldn't clear that examination, they can always choose an option for medical laboratory technician for the skill assessment purpose. All right, so with 𝐻𝐻, as I mentioned before, there are a few occupations that get assessed from 𝐻𝐻. I'm not sure how many of you are aware of the skill assessment bodies. As I mentioned earlier, when I started these slides, different assessment body with different requirements, but with 𝐻𝐻, I can tell you one thing for sure, that majority of the occupation that gets assessed from 𝐻𝐻 requires minimum 1 year of post-qualification experience. If your qualification is not highly relevant to your profession, you may need more experience. But if your qualification is highly relevant, minimum requirement is 1 year. It could be a part-time experience as well, minimum 20 hours a week. One of the other questions I get asked a lot is casual employment accepted or not? Only minimum part-time, 20 part-time, it has to be part-time, no qualification, no casual work experience will be counted. Minimum 20 hours per week part-time experience will be counted towards any skills assessment. And as I mentioned, if you have a relevant qualification, 1 year. If you have non-relevant or not closely related to your nominated occupation, maybe 2 to 3 years of work experience is required. Usually they look for last 5 years. You have to have that experience in last 5 years. Hope that helps. As you can see on the screen, industrial pharmacist, pharmacy technician, biotechnologist, microbiologist, everybody gets assessed from 𝐻𝐻. I believe with my personal experience, 𝐻𝐻 assessment body is one of the assessment authority where they have got number of nominated occupation they can assess. Their list is quite broad and quite intense. There are not many authorities like 𝐻𝐻 who does skill assessment for that many occupations, because majority of the occupation list, when we look at most of the occupations other than IT, health, engineering, gets assessed from 𝐻𝐻. So it's a pretty good assessment body if you need to look in detail about the requirements for your particular occupation before you apply for the skill assessment. Going forward for the Pharmacy Council skill assessment, so APC, or this is mainly for the pharmacist who wants to apply as a retail pharmacist or a hospital pharmacist. So if you have completed your qualification from Australia, you can see it from the first section up there. You need to collect all of your documents, apply, you got to wait, and you receive your skill assessment. It's as easy. Once you finish your study in Australia, it's quite easy to get the skills assessment. However, when we talk about the applicants from overseas, you can see the pathway in the second section up there. This is what I was talking about, CAPS, knowledge-based assessment pharmacy. So it's the full form of this is knowledge assessment of pharmaceutical sciences. So that's the exam is, but in short, it's CAPS. For overseas retail and hospital pharmacists, they have to sit for the exam. Once they clear the exam, they get eligible to apply for skill assessment with Pharmacy Council skills assessment as a retail or hospital pharmacist. Going on forward, psychological society skills assessment. As I mentioned before, some of the assessment bodies have got requirement of relevant qualification from Australia or overseas. If it's overseas, the requirements are more stricter or more in detail, I would say. But if it's an accredited qualification, it's a lot easier as compared to the qualification from overseas or work experience from overseas. As you can see, it's not just the qualification. You have to have minimum English language proficiency or English language score as well in terms of getting the skills assessment. So as you can see on the screen, you've got to have completed minimum 6 years of psychology study in Australia, or you need a minimum score of 7 each in IELTS, each module in IELTS, listening, speaking, reading, writing, and no score, less than 6.5. So that's the requirement for psychological society skills assessment for all those psychology occupations. Speech pathology, pretty much the similar requirements where there are certain areas, if you have done your qualification from the States, the UK, Canada, Ireland, and New Zealand, then there are easier requirements and a mutual recognition agreement where you can get the skills assessment done with a different pathway. However, majority of the applicants who are not from these countries, they have to get a score of minimum 8 bands in IELTS academic only with no less than 7.5. So that's the English language requirement. Whereas at the same time, it's not just the English, they have to have minimum 1,000 hours of work experience. So in last 5 years, so 1,000 hours or pretty much 12 months of work experience in last 5 years. That is something they needed for the skills assessment. If you want to get the skill assessment done as a speech pathologist in Australia, if you haven't completed your qualification in Australia, I'm repeating my words again and again. If you have completed your qualification or if you're looking forward to apply for Australian universities to study any of these occupations we are discussing. If you complete the qualification from Australia, it's a lot easier rather than if you have completed the qualification from overseas. The meeting the requirement for skill assessment makes it easier for you to apply for permanent residency down the track once you complete your qualification of studies. There may be applicants who have seen benefits of multiple skill assessment. The reason why I put this on the slide, I've seen applicants in the past where they have got a different background, but they've studied something else here. And looking at their profile, I find out they are eligible for the skill assessment from the previous studies as well. Like say, for example, if anybody has completed Bachelor of Nursing from overseas and they've got a good experience and they've worked as a registered nurse back home, and at the same time they have completed any master's qualifications. For example, if they've done Masters of Laboratory Science course here in Australia, that makes accredited course here. So that applicant himself or herself get the skill assessment as a registered nurse as well, assuming they meet the requirement of APRA and NMAC. They get the skill assessment for registered nurse. At the same time, they get the skill assessment for medical laboratory scientist as well. If you have multiple skills assessment, what it means that you have more options to apply for permanent residency in Australia, because there's no restriction. When we talk about permanent residency, we are talking about general skill migration, which starts with skills assessment followed by expression of interest, which are the two main steps for you to start with, skill assessment as well as expression of interest. So if you have more skill assessment or multiple skill assessment, you can apply for multiple expression of interest. One expression of interest as a registered nurse, the other expression of interest as a medical laboratory scientist. So having more expression of interest with multiple occupation increases your chances of getting the invitation. So if you receive invitation in one occupation, and if you didn't receive in the other occupation, you can always apply for the visa application for the invitation that you have received for the expression of interest. So having multiple skill assessment or skill assessment in different occupation always gives you a positive chance to get the invitation from the department. Now, for those of you who are not sure about GSM, what GSM is, General Skill Migration, it's a points-based assessment program of the migration pathway. There are mainly 3 categories: 189, 190, and 491. I did mention that in the earlier session, in the start of this video, that there is a difference between a long-term, which is MLT SSL list, and short-term, which is STSOL list. With MLT SSL or long-term occupation, nominated occupation, you can apply for all three visa categories: 189, 190, 491. Where if it's a short-term occupation, you can only apply for 190 and 491, which is state-nominated visas or territory-nominated visa. You have to rely on the state for the invitation. You have to meet the requirements of the state as well to apply for the state-nominated visa. You need to meet the requirements, which we are going to discuss shortly after these slides as well. What are the different states and what are the requirements? Just to give you an overview, obviously, we are at the end of financial year. We know that all the states and territories are going to release their new requirements for next financial year in the next 2 to 3 weeks of time. But I have just mentioned that in the slides as per what the current financial year requirements are for these states and whether you meet the requirements for these states or not. I don't know whether I have to bring all this information to you, whether it will be beneficial to you or not, but I thought it's better if you know what were the requirements for this financial year, because we know that it may change, but considering what the requirements for this financial year are, we can predict what could be the next financial year requirements for the state and territories would be. You might see this last ROL list as well, regional occupation list. So that's an add-on as well, other than long-term and short-term list. Regional occupation list, if your occupation as I said, there are mainly 2 lists, but the third list as well, regional occupation list, if your occupation falls under that list, you can only apply for a 491 visa, which is a regional sponsored skilled work visa. So if your occupation, there are a few occupations which if I'm I'm not wrong, dental technician or something like that. If it's, I think it is for 491 list, which is regional occupation list, you can only apply for 491 visa. Now, as I mentioned before, if your occupation is in long-term list, you can apply for 189. I mentioned 491 and 485, but at the same time, you can also apply for 190 and 491 as well. So I think I've already covered this. Short-term occupation, 190, 491, ROL occupation, only 491. What are the requirements to apply any of the visa categories 189, 190, or 491? You have to have minimum competent English, which is 6 bands in each module, listening, speaking, reading, writing, or equivalent to PTE score. And you must have a skills assessment, full and valid skills assessment, and your occupation must be from long-term, short-term, or regional occupation list. And you must have minimum 65 points on the expression of interest or points metrics. So when you do the expression of interest, obviously you need to mention about your qualification, age, work experience, and everything. This is where you kind of calculate all of your points. As long as you got 65 points, you can do the expression of interest and go further from there regarding the invitation. So this is, as you can see on the screen, 189, 190, 491. With 189, it's independent. You have to have minimum 65 points. With 190, which is a state-nominated visa, you get 5 points from the state. Even if you have got 60 points on your own, you get 5 points from the state contributed towards your total point metrics. So even if you got 60, you get 5 from state. 65 makes you eligible to apply for expression of interest in that particular state. Whereas when we talk about 491, where you get 15 points from the state, you can apply for expression of interest. 189 and 190 is a permanent residency application, but when we talk about 491, it's a provisional permanent residency. So it's not a direct permanent residency. 491, it's a provisional permanent residency. What it means that you get a visa for 5 years. You got to be living in regional area for minimum 3 years and show the income of $54,000 plus superannuation for 3 years, and then get eligible to apply for 191 visa, which is a permanent residency visa. I would like to add on a point here, because recently government announced the TISMET, which is the minimum threshold income for the applicants out there who are holding 491 visa, as well as who are on employer-sponsored visa. The TISMET has been increased from $53,900 to $70,000. This TISMET increment is only applicable to employer-sponsored visa categories. So applicants who are holding 491 visa are good to go. That's all good. You don't have to worry about it. Even if you're earning 53,900, this new TISMET requirement doesn't apply to you. So you continue, as long as you're earning minimum 53,900 plus super for 3 years, you'll be eligible to apply for 191 visa. So that's a bit of relief for all those 491 visa holders, or for those who have applied for a 491 visa in the near future as well. So I believe this is clear. I think I mentioned that at the bottom, provisional PR with 5 years leading to permanent residency for 191 visa. But as you can see, minimum 6 is required. And when we talk about expression of interest or collecting points, minimum 6 each in IELTS is the minimum eligibility criteria. But to increase the points, you may have to score higher in your English language test, or you may have to sit for NATI or sit for complete a professional year program. This is how you increase your points on points metrics, that if you're short of points. Studying in regional area, that's another good way to increase your points as well. It gives you benefit of increasing points. Studying professional year, if you're from IT, engineering or engineering, IT or accounting background, you can study professional year, and that increases your points. English, NATI, and work experience, that's another way how you increase your points. If you have got 1 year of experience in Australia, you get only 5 points. If you have 3 years, that gives you 10 points. So any of you who have been struggling with points, try to working on your work experience requirements, if you can gain more experience with your work experience points. Sorry, excuse me, guys. Okay, so moving on forward. State nominated visa requirements, 190 for 190 and 491. I'll quickly go through this session because we got a bit of limited time. I'm not sure what's the time. I'll probably have to have a look, but we got to take questions as well. So all these requirements, what I'm going to discuss now is as per current financial year. There are we are expecting some changes in the next financial year, which is literally 3 or 4 days away. So, from 1st of July onwards, we can expect some changes in the requirements from the state and territories to apply for 190 and 491. But I'm sharing this information so you get an idea of what sort of requirement was there for this financial year. So for 190 Queensland, sorry, my bad, I keep saying Queensland because I'm based in Queensland, but we're talking about New South Wales. So New South Wales 190 requirements, you have to have minimum 85 points. When I say minimum, obviously it is recommended if you have 85 plus points, because with the trend we have seen from New South Wales state government, they've been inviting applicant with 85 plus points. If you have got anything less, it doesn't mean that you can't get an invitation, but majority of the applicants we have seen is with 85 plus invitations, 85 plus points for the invitation. So if you are planning to apply for 190, try to focus on increasing your points. Whereas with 491, New South Wales, the requirement that has been changed quite a lot in the last 6 to 8 months from New South Wales. Initially, it was different, then they changed it. But as per the recent requirement, you got to have minimum 65 points for New South Wales 491 visa category, and you must have been living in New South Wales for minimum 3 months, or you have to have 12 months of employment with an employer or with a business based in regional New South Wales. So 491 requirement has been eased from New South Wales state government in recent times. But looking at the trend prior to, if I talk about 6 months ago, it was quite difficult for applicants in New South Wales. We saw a trend where New South Wales made it really hard for their applicants who were living in that state. They had to, kind of move to a different state to meet the eligibility criteria, because New South Wales criteria was quite strict in terms of state nominated visa. But as you can see on the screen, it's a little bit easier what it used to be, but it may change as well. So hopefully that doesn't change much of the criteria. If it stays the same, I'm sure they would be beneficial to a lot of applicants. Talking about Victoria, Victoria has eased the requirements as well for, skill level 1 to 3 occupations. It's mainly of if you're working in skill level 1 to 3 occupation, you can apply for 190. Depending on the annual earning you have, they kind of assess your profile. You may get the invitation, but on an average, the points requirement has been around 75 or 80 plus for 190, for 491. Even if you're working in skill level 4 to 5 occupation, we have seen that, Victoria has been inviting applicants. On an average, the requirement would be 70 plus points, including state points. And one of the major changes that Victoria did, because back in the couple of months or a few months back, the requirement for Victoria 491 state nomination was you must have been living in regional Victoria to apply for 491, which they changed not that long ago, that you can be in any part of Victoria to apply for 491. So which is a good and positive thing for applicants, for anybody who's got a job in metropolitan city. They were even eligible to apply for 491 visa. This change shows that they didn't have many applicants living in regional area. However, Victoria wanted to support and provide the invitation to those applicants who were living in Victoria and eligible for 491 as well, even if they have a job in metropolitan cities. So that's a pretty good thing. Going on further, Tasmania, I'll go really quick for the rest of the states. For Tasmania, if you have done 2 years of study in Tasmania, you get eligible to apply for 190, as long as your nominated occupation is relevant to the study you have completed in Tasmania, or when you have got a minimum 6 months of full-time job in that nominated occupation, you can apply for 190 as well. So I hope everybody's aware that once you finish your study, everybody gets eligible to apply for post-study work visa. As long as you completed 2 years of Australian qualification, you apply for post-study work visa, which is for bachelors. From now onwards, most likely it will be for 4 years. When I say now onwards, from 1st of July, anybody completing bachelors or masters. For bachelors, it will be 4 years. For masters, it will be 5 years. It's not going to be for everybody, but there is a list of courses that has been released from the department. If you have completed any of those courses, bachelor qualification would be 4 years, which used to be, I would say which is still 2 years till 30th of June. And for master's graduate, it is 3 years, but from 1st of July, it's changing. So you will have more time. And, as I mentioned, if you've got 6 months of full-time job, you can apply for state nominated visa category. For 491, 1 year studies acceptable in Tasmania. but you need or, I mean, when I say or, either 1 year study or you have completed 6 months of full-time experience from, it doesn't have to be in your nominated occupation. It could be in any occupation from skill level 1 to 3, whereas with 190, it has to be in your nominated occupation. So that's the major difference. Going with NT, Northern Territory, Darwin, 190 state nomination requirements, 2 years of study in NT and or 6 months of work experience in your nominated occupation, pretty much like Tasmania, what Tasmania had. And for NT, 2 years of study in Northern Territory. So, just a 2 year study, you get eligible to apply 491 directly. Whereas with 190, you have to have 2 years of study as well, plus 6 months of job as well. South Australia, well, different occupation, different requirements in South Australia. I cannot put that information on one slide because, as I said, there are different occupation, different requirements. Pretty hard for us to put everything in. But majority of the occupation, you have to have minimum 18 months of experience, 12 to 18 months of experience, and you may have additional requirement for that particular occupation as well. Whereas with 491 visa, if you have minimum 6 months to 18 months of experience in Adelaide or outside Adelaide, when I say outside Adelaide, I'm talking about regional South Australia other than Adelaide. Outside Adelaide, if you've got minimum 6 months to plus experience, you get eligible for 491 visa category as well. Now, talking about Queensland, it's pretty straightforward here. If you have got 6 months of, once you are on a TR to apply for 190, if you've got 6 months of full-time work experience in a nominated occupation, when I say full-time, it has to be minimum 35 hours a week. It has to be continuous. If there is a break, they may not accept it. So it has to be continuous before you do your expression of interest. And you need a job offer letter or a job contract for next 12 months to apply for 190. Whereas for 491, the requirement is only 3 months full-time in regional Queensland. Anything outside Brisbane is pretty much regional Queensland. So, if you have minimum 3 months of full-time experience, and you can apply for, 491 with a job contract of 12 months in regional Queensland as well. For ACT, the requirement for 190, you got to, as you can see, that majority of the state for 190 want you to be working 6 months minimum full-time in your nominated occupation. And for 491, it's 3 months. So I believe that the same trend will continue for this next financial year as well. But we can expect some leniency because there are not that many applicants in the state, and state and territories have got enough quota to invite applicants. And if there are not many applicants, they have to ease down the criteria. So if the requirement, they drop down a little bit, obviously it'll be beneficial for a lot of applicants out there. Talking about WA, sorry, excuse me, guys. So for WA, we got 2 years of study in WA or 6 months of full-time work experience in your nominated occupation. Pretty much the same for all the other states, but the only benefit I have seen with WA is 491, where, especially for the accounting background applicants, I know this session is for, health or allied health services courses, but, if you have been struggling in any of the state where you have applied for, either 190 or 491, or if you're struggling for invitation, WA is something that I would always recommend because we have seen applicants getting invitation, even if they've been living there for 1 or 2 months. So it's a pretty good state in terms of getting invitation. You can always look into the criteria for new financial year and make yourself eligible. This is something I've added on as well. So I hope everybody's clear on, general skill migration, which is points-based criteria. The other option is how do we get permanent residency? I do get a lot of this asked from the applicants, that what are the other ways how we get permanent residency in Australia, especially people who got background and experience in their relevant occupation, where they say, okay, what are the alternative pathways? So employer-sponsored visa, this is something you can always look into. I have done quite a lot of physiotherapists, especially physiotherapists I mentioned. And there are a few other occupations we have processed as well, where you can apply. If you got a good experience and relevant qualification, you need to find an employer to sponsor you. When I say employer, a company who can sponsor you, depending on the occupation, you may be eligible to apply for direct permanent residency with that employer, or there may be a pathway towards permanent residency if you go through employer-sponsored visas. As you can see on the screen, mentioned in the slide, there are 3 visa categories, mainly 482, 186, 494. 482 is a temporary skill shortage visa, ENS 186 is employer nomination scheme, and 494 is skilled employer-sponsored regional. Out of these 3, 186 visa, it's a direct PR, whereas 482 is a temporary visa, whereas 494, it's a provisional permanent residency, pretty much like 491 visa under points-based permanent residency visa. Now, with 482 visa, there is no age limit. With 186, obviously, there are criteria that needs to be met. The good and positive point for 482 visa is there is no age limit. If you are over 45, you can still apply for 482 visa. You need to have minimum 2 years of full-time work experience in your nominated occupation. And just to give you an example, if I've got a practice and I've got a sponsor, a physiotherapist, under my practice, as long as that person has got even restricted registration as well, doesn't have to be unrestricted, even if they have restricted registration, and if I've got a obviously unrestricted license, that person can work under my license and they can perform the duties required under my practice as a physiotherapist. So minimum 2 years experience is required to apply, and you will be granted a visa for 4 years, whereas within those 4 years, once you work with the employer for 3 years, you can apply for the permanent residency. So as I said, I don't want to go in detail, but I just want to give you a bit of overview what these visas are, what is the main difference between these visas, and how it leads to permanent residency. So 482 I have mentioned. Talking about 186, there is an age restriction, 45 year. You cannot apply for 186 visa if you're over 45. So as long as you're below 45, you can apply for it. There are 2 different categories, there are 2 different categories, direct entry as well as transition stream. For direct entry, you need a positive skills assessment and minimum 3 years of full-time work experience. And obviously, any of these visa categories I'm talking about, you need an employer to sponsor you or a company to sponsor you. But the eligibility for the visa is you need a positive skills assessment in your nominated occupation. You need minimum 3 years of full-time work experience, and you need minimum competent English. These are the 3 main criteria. As long as you're below 45, you can apply for 186 direct entry, which is a PR, direct permanent residency visa. Whereas when we talk about 186 transition visa, there is a bit of difference. So how I mentioned before, 482 visa as a physiotherapist granted for 4 years, and after 3 years, you can apply for permanent residency. So after 3 years being on 482 visa, you apply for 186 transition stream visa, which is a PR visa. So this is what the reason was I mentioned. 482 leads to permanent residency. It's not a direct permanent residency. It's a step or initiative towards your permanent residency for 186 visa. 494 visa, pretty much that it's not a direct PR, it's a provisional PR. But the beauty about 494 is not all the occupations fall under long-term or short-term lists. If your occupation falls under regional occupation list, you can apply for 494 visa. There are a few occupations that falls under regional occupation list, and there are quite a few actually where you can find an employer to sponsor you under this visa category. The requirements are pretty much similar to 186 direct entry, where you need minimum 3 years of full-time experience and a positive skills assessment, as well as competent English. You can apply for 494 visa. So importance of work experience, obviously, if you have more work experience, you get additional points. If you have more work experience, you may be able to meet the additional requirements from few states. Sometime I've seen for a lot of IT occupations, applicants with IT background or health related background, they have got the experience requirements. You cannot just apply with less experience. The requirement may be 3 to 5 years of experience. So the more experience you have, the better chances you have for the state nomination invitation to be received. And as I mentioned just before, that do not always just look into point-based PR pathways. There are employer-sponsored visa category pathways as well that leads to permanent residency. If you have any particular question, feel free to ask. But as I mentioned, there are certain requirements that you need to meet to apply for permanent residency. So talking about the courses we discussed, my colleague Aayushi discussed, and the permanent residency pathway I just discussed, it's pretty evident from the stats that I've seen. Honestly, you can see that these industries are predicted to grow nearly 300,000, more than 300,000 jobs by 2026. So since COVID, the industry has changed, especially with the health sector and allied health services courses that has become very popular and in demand. So I would say if this is something you're interested in, do get in touch with, my colleague, Aayushi, or get in touch with the relevant person. Just going on to the next screen where I just want to show that, how this industry has grown from last, probably couple of years. When we talk about healthcare and social assistant courses, as you can see, the demand has been quite substantial. Over 300 jobs are already available, and we expect a lot more coming in the near future. So as you can see on the top, healthcare and social assistants, followed by scientific and technical services, education, training, accommodation, and food services. But this is where you see on top, healthcare and social assistants. Employment by sector, health sector and social assistance. Obviously, hospitals has always been the top priority for applicants studying the relevant health courses or, studying in the health sector. Hospital has been the private, preferred destination to work, followed by, other social assistance services, allied health services, residential care like aged care, or disability care providers, medical services, childcare services, followed by pathology or other healthcare services. As you can see, the numbers, in hospital, the maximum numbers, it's nearly, I would say, over 550,000, employees are employed under health sector in hospitals. Most popular occupation that we have seen the strong demand, hospital pharmacists, retail pharmacists, speech pathologists, clinical psychologists, organizational psychologists, and there are a few more as well. But, don't worry about this agriculture. This is something I highlighted by mistake, so my apology for that. But as you can see, these are the most popular in-demand courses, what we have seen in the trend. But other than that, there are other occupations that we already discussed, physiotherapists as well, and medical laboratory scientists, which has become very popular since COVID outbreak. Registered nurses, this is just an overview and snapshot. How many nurses were present in Australia as a registered nurse, working 235,000 in 2014, but it has increased to 280. But I'm pretty much sure, we're looking at the current stats, it's nearly 400,000 nurses that are currently working in Australia as a registered nurse. I'm not 100% on that, but I'm quite positive it's somewhere between 350,000 to 400 nurses available to work in Australia. And for enrolled nurses, as you can see, it's nearly double what the stats what we're looking at. It's quite old. I was trying to find out the new stats for enrolled nurses as well. Couldn't find it out, but I'm sure the numbers have substantially increased from last few years in health sector. Pharmacy technician, on an average, the salary is about 60 to 70K. And, the demand is quite strong. And, the areas you can get job in, health pharmacies, Chemist Warehouse or Australian Priceline Pharmacy and all. You can work in a medical production of the medicines as well. Sorry, so sorry guys, medical laboratory scientist, talking about this. Again, very good profession, highly recommended for those who are planning to get into this industry. As I mentioned earlier in this live session, that, it's a pretty unique and niche area where not many applicants have got into this industry, and there is a huge demand for these sort of occupations. A lot of jobs available as well. Try to do a bit of research about this course, quite promising with future career prospect as well as permanent residency. General practitioner, mainly focusing on doctors or GPs. Definitely huge demand out there. Workforce have been, you can clearly see in 2011, the stats are pretty much up to date. In 2020, it has tripled since, in last 10 to 12 years. It has tripled till 2020, as you can see the numbers. For RN, enrolled nurses, medical laboratory scientists, pharmacy technician, and many more. There are plenty of jobs available out there. If any of you, who is willing to start their journey in Australia or study any of the health sector related courses, this is the best time where you should be taking initiative and start getting your career shaped into the right manner, where you can get the permanent residency as well. And at the same time, you got a good break in your career as well, where you can end up getting a good job in the health sector. So highly recommend to do your research. Any of the courses you're interested in, feel free to ask. So guys, I think that's pretty much it. It's pretty much all the information that I wanted to deliver. So Lee, and if you're still connected with us, we probably take some questions. So yeah, I think that's
sure.
all I wanted to confirm.
Sure. Thank you, Aayushi and Prince,
Thank you
for
so
a very
much.
informative presentation. So we have some questions here. The first question from Tina. She asked what are the job outcomes that I can have after completion of a Master of Health Management course and PR options for me? And she also have another question below. I'm planning to study this course in Brisbane in Tech October. I consulted with your consultant, so I want to know my career prospects and the chance to get PR afterward.
Right. Okay. For health management course, I'm not sure, Lee. Sorry, I missed the name of the person who asked this question.
Tina.
Hina. Hina, I mean, with health related courses, obviously, the biggest challenge, and don't get me wrong, the biggest challenge that I've seen is, finding a job in the nominated occupation. Whereas, there is a huge demand. We all know that with the nominated occupation, talking about the nominated occupation, there is primary health organization manager. That is something that you can apply as. And at the same time, there is a, health information manager. That is something you can apply as, or health promotional officer. These are the few nominated occupation that you can nominate once you finish or complete the study. And as I mentioned, the only thing that I have seen with health related courses, it's not like they're not in demand. They're really high in demand. There is a big prospect out there for the jobs available as well. But in these sectors, because being an international students, it's really hard to get a break while you're on a temporary residency visa, because you do need an experience to get the skill assessment done, which is done through 𝐸𝐸. That's the assessment body for all these, nominated occupation that I mentioned, 𝐸𝐸, and they need minimum 1 year of post-qualification experience. However, if you end up cracking a job, if you have minimum 20 hours a week for 1 year after qualification experience, you can get the skill assessment in any of these occupation, which leads to a very good, promising career as well as permanent residency.
Thank
I
you,
hope that
Prince.
answers your question, Ina.
Yep. Then the next question from Suranjana. I saw Ayushi already answer, but Ayushi, if you need to add more information, the question is, hi, could you just list out on the courses that you mentioned once again? This does not apply for people wanting to study Doctor of Medicine, meaning being a doctor. Is that right?
Yeah, that's correct, because I've just discussed all the A-led health courses and I've listed down all the courses such as lab medicine, physiotherapy, occupational therapy, speech pathology, biotechnology, psychology. At the end of this session, these sessions will be uploaded on YouTube. So just in case if you still want to go back and refer to those sessions and the information that Prince and I have provided, you can certainly go back. Or if you have any further questions, you can contact our team and we'll be able to assist you further.
Yep, sure. I will post the email of Ayushi and Prince here, so you can email them if you have more questions. I can see another question, a very long question, from Sranjana, and I think it's the question for Prince. It's very long one, but in short, Sranjana says, how do you suggest if we can study one course and then we go for TR and then go for PR, or we study one course and then study furthermore and then go for
Sorry,
TR and then
sorry,
for PR.
sorry,
So,
Leah, I missed out
yeah,
completely. One course study other course. I think I
yeah,
can read the question.
yeah,
So it's
sure,
from
sure.
Suranjana. Around how long does this whole? I'll read the question as well, so everybody else who's connected with us this in this
Yes,
session,
yes, yeah,
they get to know what question has been asked. It may be beneficial for them as well. So Suranjana is asking around how long does this whole PR process takes after graduating? That's the question, right? Lee,
yeah,
is this
yes,
the
yes,
question?
yeah, that's
Okay.
the one. Yeah.
Right. So how long does it take for the pre-PR process after graduation? For example, if you do a Masters of Nursing, is it recommended to do TR after graduating one of these courses while we apply to get PR, or we use TR beforehand, meaning before we start our Masters, after the completion of my bachelor, then doing a Masters course later? I guess my question is whether the TR should be saved for later. Yes, I understood what your question is. If we were to
Yeah.
study further, then take, or is it okay to use now and it would be hard to go directly to it? Okay. All right, so guys, I just put it in a nutshell for everybody who joined this session. Saranjana is trying to ask, which is a very good question, Saranjana, and I appreciate you asking this question because that shows me that you are really serious about your career and the decision that you want to take. You do not want to regret it later, and this is what I always recommend everybody. Whatever decision or step you are taking, you got to make sure that you stick to that plan because you don't want to be in a situation that why didn't I do this a year ago, or what did I do? What am I going to do now? So basically, what Saranjana is asking, whether is it a good idea if anybody has completed bachelor's qualification and if they want to continue study in a different profession, for example, master's, is it a good idea to apply for master's after that, or it's better to apply for TR and then use your TR later on, study master's on TR or maybe after TR? So Saranjana, in short, the answer to your question is it really depends on the course that you have done in your bachelor's, and if you were to study bachelor after masters after bachelor's, what is your reason behind it? Because to me, if I have done a bachelor's qualification, I need to make sure that before I study any course, if my aim or my goal is to apply for a permanent residency with a good career prospect course as well, so have I chosen the right bachelor's qualification or not? That is the first step I'll be looking at if I'm going to start my bachelor's, that whatever I'm getting into, I should know what are the outcome of this particular course in terms of career as well as permanent residency. Now, saying that, for God forbid, and in case if I cannot find a job after my bachelor's qualification, it's not because I'll be sitting on I always recommend to apply for a temporary graduate visa rather than applying or continuing study after bachelor's. Reason being, with new changes coming up from 1st of July, back in the days, we used to get only 2 years of temporary graduate visa. But from 1st of July onwards, majority of the bachelor's occupants will get 4 years of TR. That's a massive time frame, I believe, in order for somebody to get eligible for permanent residency. So I don't see any point for any single individual to go from bachelor's to master's study and then apply or saving the TR for later. I mean, with that pathway, I don't I see that, that applicant won't have permanent residency for good 7 to 8 years. But answering your question, how long it takes, if you do the right master's and right bachelor's as per your interests, and assuming you meet all the requirements of skill assessment body and the points requirement from the department, the whole process from your day one journey in Australia to the permanent residency shouldn't take more than 3 to 4 years, right from scratch to the permanent residency. On an average, that and this 3 to 4 years includes your 2 year of qualification, minimum qualification. If it's bachelor's, it could be more, but I'm talking about mainly for master's applicants, 2 year qualification and another 2 years to make yourself eligible for PR. I think 3 to 4 years is a maximum time frame for any applicant to apply for permanent residency in Australia. I hope that helps everybody of you who are watching this video. I think thanks a lot, Suranjana, for asking such a nice question.
Yep. So the next question for Aayushi, is it necessary to be a licensed laboratory tech to study master in laboratory medicine? The student will be from Philippines.
No, it is not necessary to be a licensed lab technician. All you have to have is a cognate background to study a Masters of Lab Medicine course. So if a student is from Philippines, there are two other options. So let's say if he comes here for Masters of Lab Medicine, this is a direct entry requirement. But if he doesn't meet the direct entry requirement, he can go for Certificate 3 in Pathology leading to Diploma of Community Services. And then if he is already a registered technician back in the home country, you can assess your degree through AIMS. So this is one pathway, or you can come here for Certificate 3 in Pathology leading to Diploma of Lab Technician and then eventually pave your pathway towards your bachelor's or master's. But yeah, you don't have to be a licensed technologist, just to answer your question directly.
Thank you, Aayushi. So the next one from Hannah. This is for Prince. Can I apply for PR from offshore under pharmacist occupation? So what is the chance?
Definitely. Sorry, what was the name of the person who asked this question?
Hannah.
Sorry,
Hannah.
Hannah.
Yes.
Okay, definitely, Hannah. You can certainly apply for the permanent residency from offshore as well. Now, when you say pharmacist, obviously there are different category of pharmacists. We got retail pharmacists, hospital pharmacists. Depending on your background, what relevant work experience you have, there may be additional requirements for you to meet. If you are an overseas pharmacist, as I mentioned earlier in this session, you may have to sit for a CAPS exam, which is a knowledge-based exam through APC, which is Australian Pharmacy Council. You have to sit for an exam. Once you clear that exam, you get eligible to get the skills assessment from APC as a retail or hospital pharmacist. Whereas if you have been working as a pharmacy technician, you can reach out to VETASYS for the skills assessment where you need minimum 1 year of work experience after your qualification, and you can apply as a pharmacy technician under state nominated visas, which is 190 and 491.
Yep. Thank you, Prince.
No
The
worries.
next one from Do. Do we need clinical experience to get the registration as a registered nurse after doing outcome-based assessment?
So after doing OBA, there is no such requirement to do a clinical placement. However, for the registration with AFRA, they do require you to be working as a registered nurse for 3 months in past 5 years. That is just the AFRA requirement to be a registered nurse. But it can be within anytime 3 months within last 5 years.
I think there's minimum requirement, if I'm not wrong, Aayushi. I think it's 296 hours or 496 hours. I forgot that has been changed, but there are certain requirements, maybe 300 hours. But in short, 3 months in last 5 years, that is required for registration. And as long as you got that, you can apply for registration.
Yeah, right.
Another question from Louis for Aayushi. What is the better option to study diploma of laboratory technician or go for the master's in laboratory medicine?
Sure. Now, if you would have seen my slides, I did discuss about the vocational courses available for lab medicine courses. However, because the skill assessment require level 1 study, which is a bachelor's or a master's, so even if you study a diploma of lab technician, you would eventually have to end up studying bachelor's or master's. So let's say if you are directly eligible to apply for a master's of lab medicine, I would definitely suggest you to study that course. So that will give you a straightaway skill assessment pathway with aims in regards to your course and the pathway for PR.
So yeah, just would like to add on something to this, to Louis. Obviously, Aayushi, you mentioned about the course itself. It's really important to understand this as well when you answer this question. When you ask this question, Louis, that you study masters in medical laboratory scientist or you should study diploma of medical lab technician. Just keep in mind, because it's not just about studying the course, you got to see whether you can apply for a temporary graduate visa as well after completing the study. So temporary graduate visa is a visa that you can apply after the study. If the course for diploma of medical laboratory technician, if you complete it, falls under short-term list. And if because with the new requirements coming up from 1st of July, next week for Australian 485 graduate workstream visa, because if you study any certificate or diploma level course, you can only apply for graduate workstream 485 visa. What it means that you need an occupation to be in a long-term list. So I know it could be a bit confusing for you. I'll repeat that again. You have to have an occupation on long-term list if you want to apply for a post-study work visa under graduate workstream. But medical laboratory technician falls under short-term list. Now, if you study that course diploma, you may not be eligible to apply for a 485 visa under graduate workstream. That is a work visa. So just keep in mind that you are aware of, you may not be eligible to apply for temporary graduate visa. But if that's not something that bothers you, by all means, it's a good course. But saying that, my recommendation is always for medical laboratory scientists, because you can apply for, post-study work visa as well. I hope that helps, a little bit for you to make up your mind which course you should go for.
Sure. So okay, Aayushi's come back. So, okay, because you have the next question, Aayushi. This is from Priyank, and she asks how to know if the course accredited or not, like postgraduate in biotechnology in Lathrop.
So one thing to know is you can definitely check the website. So pretty much when the courses are accredited, so let's say if it is Lathrop University, they would definitely mention this in big bold letters that the courses are accredited. First of all, I would let you know that even if the courses are not accredited, you still can apply for skill assessment. That is not stopping you from applying for the skill assessment. However, the accredited course is a peace of mind that you are definitely getting a positive skill assessment from them. Because sometimes there are subjects missing from those universities or from those components for you to get a positive skill assessment. And that is the only reason the accredited courses are necessary. With biotechnology, you don't have to worry, because biotechnology, the skill assessment authority is VETASYS. So there is no such accredited course that you have to complete. You can complete Masters of Biotechnology, get your 7 each and go for a skill assessment. However, the only requirement VETASYS have, as Prince explained earlier, is you have to show a 1 year of post-study work qualification. So once you complete your degree, you have to work as a lab technician or as a lab medicine scientist, and then only you can get your positive skill assessment from VETASYS.
Sure, thank you. So I guess this is the last question from Punan. He said, I completed BPT in India 2018 and 4-year experience in India. I took admission in MPH in UQT. Is it worth for me, sir? IELTS overall 7, listening 7, reading 7, writing 6.5, and speaking 6.5. So, Prince, can you please answer this question?
Sure, but this BPT would be.
So I will just take the initial part of this question. So if she has completed Bachelor's of Physiotherapy in India, and she has a 4 year of experience. So Prince, you can discuss about the skill assessment pathway. But let's say if you come here to do Masters of Public Health, again, as Prince explained in the first end, the qualification that you would be nominating yourself is a primary health organization manager. And again, the only challenge we face in going with the skill assessment for this qualification is you don't get a straightaway position to work as a primary health organization manager, because that is a very high position to get, and you eventually pave your path towards that position, but you straightaway won't get that position. I mean, it's pretty hard to get that position after you complete your studies. But let's say if you would have completed Bachelor's of Physiotherapy in India with 4 years of experience, Prince, can she get a skill assessment on the basis of that?
Definitely she can, but as I mentioned in the earlier session, if anybody has got a qualification and work experience from overseas, obviously you are not eligible to get the skill assessment straight away from Australian Physiotherapy Council. But Poonam, you have to sit for an exam that you need to clear. And once you clear that assessment, you will be given a registration with APC. And once you have that registration, you can get the skills assessment straight away. So you can definitely apply for the permanent residency while you are overseas as well, but you don't have to be in Australia to apply for permanent residency, as long as you got the skill assessment and meeting the points requirement. But in terms of studying MPH, by all means, if you're confident with your profession, where if you can end up getting a job in that profession, either health information manager, primary health organization manager, it's a very good profession. But the reason why I shared, or Aayushi is sharing her experience, because we have seen this is where the challenge has been, because these sort of occupation, you have to have good number of years of experience under your belt before you end up getting to these positions. And for a recent graduate, it's not easy to get into this position straight away. This is like probably for somebody who has got a good experience for 3 to 4 years, or maybe 3 to 5 years, and if you got that experience, which I think you do have 4 years of work experience overseas. If you have that experience, and if you study this course, and if you find a suitable workplace where you can get a position offered as a primary health organization, MPH is a very good course to go for. It's not like I haven't seen any. I've seen a lot of applicants in the past, but with my experience, the applicants who have ended up getting a job offer or, in a profession as a health information manager or primary health organization manager, they had some prior experience. So if you are a graduate, bachelor's graduate coming to study master's, I would recommend to look for, more options at the same time. But if you got some experience, I would say you got to be, as long as you're confident, if you can end up getting a job, by all means, you should go for this. It's a very nice course.
Also, if you would have completed Bachelor's of Physiotherapy, you are also eligible to apply for occupational therapy or physiotherapy for master's level course in Australia. So rather than going for public health, you can definitely opt for these courses, where again, you might not have to sit for any professional exams, and you can straight away go ahead and apply for the skill assessment later down the line.
That would be a better option rather than just going with MPH, what Aayushi mentioned. Like, if you have got accredited qualification in Australia, you don't have to worry about after completing a master, because that will definitely give you registration as a physiotherapist.
Yeah, that's great. And we have a follow-up question from Suranjana.
Yeah.
Thank you for answering my question earlier. I just had a follow-up question. If I were to finish a Master of Nursing course or Doctor of Medicine course, is it easy to go for a PR straight away, or would I need to a TR first?
Should I answer this, Aayushi, or are you going to answer this?
Say Masters of Nursing again is one of the very popular course, and again similar thing with Doctor of Medicine. Doctor of Medicine, depending on whether you complete here in Australia or you complete back in your home country. So let's eliminate that by saying that if we go ahead with that Doctor of Medicine studies, you have to give a couple of professional exams here, clear those exams, and then you're able to apply for a skill assessment as from MedBA, I think Medical Board of Australia, Prince, if I'm right. Yeah.
Yep, that's right.
So that is one way. It's a tough exam because I think it's hard to crack, but people have been cracking it. So that is one way you can study. Or if you study a Masters of Nursing course, this is again one of the evergreen courses that we have in Australia. People have been getting invitations with even lesser points, and even a very booming field in future as well. So yes, in regards to your question whether it is easy to get a PR straight away or if you should apply for TR first. Now this is again optional. So let's say if it is if you want to apply for TR, it's up to you. This is only giving you an extra 5 years of time or 4 years of time for you to be in peace of mind that you don't have to rush into things. And let's say if you don't meet the requirements, let's say if you don't have a positive skill assessment in time, because if you would have 2 years of visa to study master's course. Okay. Now within that 2 years, you have to make sure that you finish your IELTS, you finish your skill assessment. Skill assessment can only be done once you complete your course. So you wouldn't have that amount of time to process everything. So for that, the other visa that you can apply for is a temporary residency visa, which gives you another 3 years of leeway because you have plenty of time to organize your pathway to PR. Also, once you apply, you are not going to get an invitation straight away. So for that also, you would need some kind of time. So what you can do is you can apply for TR. That is the best solution I can give you. Wait for the invitation. Once you get the invite, once you are on a bridging visa, obviously within that period of time, you are eligible to apply for PR, or you will be able to get your PR as soon as possible.
Thank you so much, Aayushi. That was answered pretty well, I guess. Suranjana, I hope you got the answer. So TR is required after studying the course, regardless you go with Doctor of Medicine or Masters of Nursing, because when you're granted a student visa, it is granted as per the COE, or which is the confirmation of enrollment. Depending on the duration of the course, you get maybe 1 or 2 months ahead after, like once your course is finished. So you do need time to prepare yourself or make yourself eligible to apply for permanent residency. So definitely TR would be required after your completion of study.
So I guess that's the last question for this session. Thank you, Prince and Aayushi, for your very useful information and for your answers on the questions here. So guys, thank you for joining us today. And you can watch our session on YouTube later on. And if you have more questions after this session, please feel free to reach out our team. I put the email there, prince.pahal@aussiegroup.com or ayushi.shah@aussiegroup.com. And I would suggest, Suranjana, if you want more about the course, you can reach Aayushi for a free consultation. Okay, thank you, guys, and thank you,
so
Prince
much,
and
everyone.
Aayushi. Yeah.
Thank you very much,
Nan.
everyone.
Thank you, Prince.
Thanks a lot, Aayushi. Thanks a lot for being a great host, Lee. And I hope it was beneficial to all those who joined us. But as she mentioned, if anybody of you have got questions, please reach out to or send us an email on our email addresses. Thanks once again, everyone. Enjoy your day.
Thank you, everyone.
Thank
Have a
you.
good
See you.
evening.
You too.